Welcome back to New Day Cleveland. So it is no secret. We all have a lot going on these days, but it's important to remember to never neglect your skin's health. So here with more is Dr. Lauren Karpinski from Apex Skincare. It is so good to see you, Dr. Karpinski. Thanks for being here with us this morning.
Oh, you too, Natalie. Good to see you.
Well, this is one thing I do all the time. I neglect my skin. I do get my yearly checkups for all my moles or anything like that. But when it comes to, I think, daily things, I do neglect. Do you find that a lot of people do that as well?
Well, we did see a drop off in the number of patients coming to their annual skin check exams when the pandemic started. Understandably, I mean, we've had a lot of concerns about health, but skin health needs to be addressed too. We did see a slight uptick in skin cancers in patients that were returning to the office that had missed their appointments.
Wow.
So important to make sure that you're keeping on top of those things. Just like your annual well check with your primary care physician, it is important to check your skin all over once a year as well.
Yeah, I stay on top of it because I had a spot that seemed atypical. Thankfully, I was okay. But with skin cancer, and correct me if I'm wrong, but it can appear fairly quickly. And you might think you're fine, and then the next minute, you're not.
Yeah, there are some skin cancers that can grow in just a matter of a couple weeks where it looked like a small pimple and then, 2, 3 weeks later, it has almost doubled or tripled in size. There are some that are more slow growing and it takes a little bit longer to notice those, but that's kind of where your dermatologist comes in. But definitely for those more quickly growing ones, you should give us a call as soon as you can.
And Dr. Karpinski, we're looking right now at the 5 signs of skin cancer. I'll let you briefly go through them real quick if you'd like to.
So we call those the A, B, C, D, E's of skin cancer. So A stands for asymmetry. You want things to look the same on both sides. So if you fold that spot in half, is it going to look the same as it does on the left and the right? Borders is B. So again, borders should be nice and smooth. They shouldn't be jagged or irregular. Color, we want the color to be the same throughout. D is for diameter. We generally want moles and other spots to be smaller than a pencil eraser. And then E is the most important. That one stands for evolving. So any spot that's changing or just looks funky to you, I want you to give your doctor a call.
And when we're looking now, we're just taking a magnifying glass. We're looking at just the image of that. Is that something that you should I know you should take note yourself of what you have on your body, but is it important to maybe even magnify that yourself and look at it through something like a magnifying glass?
Not necessarily. Your dermatologist may use a special magnifying glass with a polarized light to look at pigment under when you're getting an exam. But at home, it's just most important that you become familiar with the spots that you have so that you'll notice if something's changing or if something is brand new.
So people I know oftentimes, aside from skin cancer even, they have chronic skin conditions. Maybe sometimes people even suffer through things that they don't have to because they don't come in to see someone like you.
So there's been a tremendous improvement in the number of treatment options that we have available for a lot of chronic skin conditions, eczema being one, psoriasis being another. There are a range of different options for all of these skin conditions, from topical medications to oral medications and even injectable medications that only require treatment every 2 weeks to up to 3 months. So a lot of times patients are suffering with skin conditions that not only are we able to improve significantly, but in some cases clear up completely.
So I know you have a bit of an offer for our viewers today, and I know that's really exciting too. I'll let you address that.
So right now, Apex is having a sale on their skincare line. So we do have a package deal for $199 that includes a cleanser, a moisturizer, a sunscreen, and our lip boost. We also are having sales on cool sculpting right now in case you want to get rid of some of those tough areas that you've been working on over the holidays.
Honestly, anything that you have that you're wondering about that relates to your skin, they can take care of it at Apex Skincare, and they have locations all over Northeast Ohio. So if you go to their website, you can find out more information. Which office are you at, Dr. Karpinski?
I'm at our Medina office.
So you can go and visit her there in Medina as well. It's always a pleasure seeing all of you. They just work with such great people. Every doctor we speak with from Apex are just so kind, and I know that translates to having a great doctor there in the rooms with their patients. So have a wonderful holiday, and thank you for joining us this morning.
Oh, you too, Natalie. Thank you.